Hi, everyone, and welcome to today's event, Closing the Gap, a fireside chat on health equity and policy. My name is Olivia Phillips, and I'm the manager of health equity initiatives here at Matter. Matter is a healthcare technology incubator and innovation hub with a mission to accelerate the pace of change of healthcare. And in service of this mission, we do three things. First, we incubate startups. Since we launched in 2015, we have worked with more than 800 companies that range from very early to growth stage startups, and we have a suite of services to help them at every stage of development. Second, we work with large organizations such as health systems, life sciences companies, and payers to strengthen their innovation capacity. We help them find value in emerging technology solutions, empowering internal innovators to unlock the value of their ideas and create a more human-centered healthcare experience through system-level collaborations. And third, we are a nexus for people who are passionate about healthcare innovation. We bring people together to be inspired, to learn, and to connect with each other. We produce a lot of programs, including large-scale events for the broader community, like today, and small forums exclusively for our members. So today we are excited because we are joined by Dr. Angela D. Reddix, founder, CEO, and president of ARDX, a leading government health management and technology consulting firm, for a conversation on federal policy, health equity, and insights gleaned from data collection and analysis. Angela brings in-depth knowledge to working with federal, state, and local governments on translating regulatory policy and guidance into digestible information and insights to ensure businesses are able to navigate complex regulatory landscapes to increase access to quality and equitable healthcare. Before we jump into the discussion, I'd like to introduce our moderator, Dima Elissa, founder and CEO of VisMed-3D. If you have any questions throughout this program, please put them in the chat, and Dima will weave them into the conversation as appropriate. With that, I will pass it over to Dima to introduce Angela and dive into the discussion. Thank you.
Thank you, Olivia. That was fantastic. As you know, I am one of the biggest champions of Matter, and what we hope today to do is really hit on all three of those pillars that you mentioned that Matter aims to support and promote. So I'm delighted to introduce Dr. Reddix. I have had the privilege over the last year and a half now, I guess, serving on her board of directors, had the chance to really get to know and see the person behind the power of ARDX and understand how it came to be and the view of success from her vantage point, and her journey is just profound. And I can't wait for you to meet her and to hear more about her and her journey. And with that, I think Dr. Reddix, you can join us. Fantastic.
Hello, hello.
Hello. What a day.
It is a beautiful day. I'm excited to be here, excited to connect with the Matter Health community, especially regarding the vision and mission of this organization.
Yeah, absolutely. It's kind of the perfect, as Olivia said, nexus for the kind of things that you've been doing. And you know, I'm truly, as I said, privileged to be serving on your board, and I've come to know much more about you and your journey. And the more I learn, the more I'm just blown over. So what I wanted to do is have you share your origin story of how ARDX came to be, because it's not easy for a woman of color, a woman in the government space to really develop and flourish a business in such a complex area of government. And I think it would be fantastic for you to share kind of how it manifested.
I would love to. Thank you. And thank you, Dima. I just want to say, I hit the jackpot when we were able to find someone so competent and so committed as Dima to join our board. So I'm grateful for the opportunity to spend the time with you today. Our the ARDX story. There's so many legs to this story, but I will just say, in particular, I'm hoping that in the audience in this community, there are the healthcare innovators, because I could not have told you some 40-ish years ago that I would be in this unique position that I'm in. And so if I were to give anyone, an entrepreneur, and I love speaking to entrepreneurs, my world is the intersection of healthcare and entrepreneurship. That is what I've been for the last 30 years, can't believe. And so what I would tell anyone is that the secret sauce is in the policy. We have built an entire organization with staff throughout the United States, simply following the policy and the legislation, understanding what it means, and understanding the importance of cascading that message down through the government legislation to those who are who operationalize the legislation, and in our world, it's the health plans, down to the front line individual who is the beneficiary or the patient. And so that's the world that I live in all day, every day. Our story starts, my recommendation to every entrepreneur is to grow where you're planted. I rose up through corporate America, had an opportunity to join a small, very small business that had a contract with Kaiser Permanente to implement a claims processing system for their entire network. And I took that opportunity with this no-name, small business. In fact, I was the third employee of that business and was given the opportunity. It's so funny. I think of my life based on the age of my children. And so it was my firstborn, and she was not even a year old. And this opportunity took me all across the United States to implement this legislation, or this claims processing system. Little did I know that was my introduction to healthcare, and that how much I would learn from that opportunity. It was ever changing. If anyone's worked on implementations of systems, you know, it's just, we did the development, we did the implementation, we did the training. There were long days, long nights, and weekends, but we did it. From that opportunity presented another opportunity for me to join a federal government contracting firm. And from there, I was introduced to the federal government world. I came into a situation that wasn't ideal. I didn't realize that there were challenges that the organization was facing on the implementation of a system nationwide. But I stepped into an opportunity that many would have run from. But I'm so glad that I saw it through. I was able to rise throughout the corporation. But I
Isn't
learned.
it your first day, you come to work, and by the second day, you get a surprise, right?
Oh, absolutely. That I'm taking over for my boss who hired me. And so with that, in the face of adversity, it's been the story of my life, to face it, to push through it, to build relationships along the way. And that's exactly what happened. I became an expert in the world of Medicare and Medicaid, and years later, relocated back home to the Hampton Roads area. And because of that relocation, ended up forming the company that 17 years ago, this month, we've been around for 17 years. And it is understanding the legislation, understanding my clients, and having a real passion for the vulnerable populations that we help implement programs to ensure that all Americans have health care.
That's brilliant. And I know there's a lot of blood, sweat, and tears that went in through that journey. And, you know, having opportunities kind of present themselves that are really, really difficult and uncomfortable is kind of similar to what the entrepreneurial journey is, because
Absolutely.
you know, when you find the pain, if you push through it, it opens the opportunities up, and that's when you find the gain. And I think, you know, you have clearly created a pathway that has given you visibility and access to an understanding, a level of understanding of our healthcare system, deep and wide, end to end. And it's a remarkable position and enviable in some ways, because if there is anybody that understands the value, the importance of health equity, it is you and the team that you've built. Because I can see how being so close to the policy, you know, from probably writing it and helping guide it to operationalizing it and implementing it, and then seeing how it plays out, that must really give you an understanding of the shortfalls of health equity and how it's impacting. You know, today we hear health equity left, right, and center, but what does it really mean? And from your vantage point, having really experienced from the government and to the consumer end in some ways, what is your definition and how do you crystallize health equity?
Ooh, that there's layers to that response. And let me just say, I'm fortunate to have a vantage point from being first the individual who was born into poverty, who was born to a single mother, who was raised in public housing by my grandmother in a community, who went to the public clinic. That's how my healthcare was provided in those early years. And you know, when you think about poverty and you think about the cycle of poverty, where there is crime, where there's teenage pregnancy, where there's high school dropout rates are higher, et cetera, which is what I studied for my dissertation. It is amazing, according to the statistics, that I sit in a position today where I am in the heart of public healthcare, running a business that does the important work like executing on the Medicare Advantage programs, that executing on the Affordable Care Act. And so I recognize it first because that was me. If it were not, when I think about the 7 social determinants of health, every last one of those, and understanding how important it is to provide a safe environment where people can get over the obstacles, the barriers that exist through the lens of those 7 social determinants of health, it was my life and decisions and community that rallied around me that allowed me to be in this position. And so it's a personal thing for me when I think about health equity. And I believe that every human being deserves to be able to have access to healthcare with every fiber in my body. I believe that. And so I'm honored to be able to do the work every day. Our little piece of work that our company works on, it matters. And so when we attract individuals to this organization, that's the story that they hear, because this is not a place where you can come, clock in, and leave and do a job. No, the work that we do, it matters. It matters to that individual. We help to implement the Medicare Part D program. And there are seniors who had to make decisions on whether they chop up a pill to last for a week or if they eat. Now, we know the efficacy of drugs, and if you're chopping it up, you're not getting what you're supposed to get. But people are simply trying to survive. So it matters. It matters that we rolled out the Affordable Care Act and that millions of individuals were uninsured because they had pre-existing conditions. But that mother who is suffering with cancer can now have insurance, and her children can grow up to know their mother. Health equity for me, it means that individuals can show up in the workplace and be all that they can be because they have compassionate leadership that recognizes that we don't just bring a part of ourselves to work, we bring our whole selves to work. And so I see it from several angles, and I'm grateful that I get the opportunity to see it from the legislative perspective, and that I saw it from the recipient of it as a child. And now I stand in a place where I am empowered to make the workplace a better place from a health equity perspective because I know enough to do that.
Oh, I'm just sitting here chilled because you expressed that so perfectly. And, you know, you, to me, are the picture of health equity. You have persevered, you have overcome the obstacles that many face, and yet you must have had some support mechanism that gave you an opportunity to want to get better, to do better, to get educated from a undergrad to an advanced degree to a PhD. So I think, what are those variables that are missing in our employee base, in our leadership, in our communities? Where is it just that they don't understand the implications of the social determinants of health, and it's just a bunch of acronyms? Or how do you help people understand and quantify, or at least get a hold of the importance and the impact that these 7 determinants of health are affecting their bottom line in a business context, but they don't have a line on the P&L, right? It's affecting it, but they don't see it directly.
You know, I think so. There's a macro level to this, and then there's a micro level. And the reality is, do I think the average American understands it? No, they don't know the language. They're not studying the language. They're just trying to survive out here. They're just trying to deal with whatever they have to deal with to make ends meet and to take care of their kids, et cetera. Are they translating the things that we hear in the news? Are they translating that to that? I doubt it. And so from a macro level, the legislation, very few of the average American will ever touch the policy. I mean, and understand the policies. And so the way they can influence policy is by voting. So everyone has the opportunity to influence it from that level. So let's just take the average American is not the one writing the policies, okay? So then if we take it down a notch, the average American spends, at least if we look at a 24-hour day, 7 hours about, if we're doing what we're supposed to do, we're sleeping. Okay, so it's about 7 hours of that. You talk about 10 hours on average, whether it's your commute or depending on what level you are, 10 hours of your day is in the workforce. So that is 17 of the hours of the 24 hours a day. So you don't have much more time outside of that. The majority of our time is spent in the workplace. So we at ARDX have really spent time, when you say what has driven me from my undergrad to grad to my PhD, from what I do day in and day out, I am telling you, it's this discovery. I went back for my PhD after I'd already formed ARDX. 3 children, a husband, and a company. And I went back to work on my PhD because what was keeping me up at night wasn't getting new customers. We were growing, doubling and tripling our revenue every year. It was what makes our staff tick. Because it's not just the money. We were throwing money at people. We were giving you profit share. I mean, it was, and still, there was still stuff. And so what is that? So I went back to focus on organizational behavior. Well, what I learned from being there was actually, I ended up, my dissertation is focused on entrepreneurship and deliberate practice, also known as expert performance, and exerting enough effort into something that you can become an expert. And so I studied that in a community of girls who were experiencing poverty, to determine if the intervention that I'd created, if it could influence them so that their self-efficacy, their ability to have self-control, their ability to have conscientiousness and delay gratification, if that could be impacted and therefore be an indicator of being a strong entrepreneur. Well, my hypothesis was proven. I defended the dissertation and formed Envision Lead Grow, which is now a thriving nonprofit where we have over 2,000 girls in 48 states who become thousandaires using this model. But that same logic that I'm talking about that took me to my PhD and studying deliberate practice and expert performance, it applies to the workforce today. And here's what I mean. At ARDX, we have studied and built programs to help companies understand how health equity impacts their bottom line. A more efficient, productive workforce increases their bottom line. So when you say it's not on the P&L, it actually is. It's on the P&L in the form of turnover. It's on the P&L in the form of claims. It's on the P&L in the form of increased costs for healthcare. And so I believe in these 3 C's. If we could help the companies where people are spending the majority of their time recognize that to have a healthier workforce, it takes having courageous conversations. It takes leading with compassion, and it takes a commitment to recognizing the 7 social determinants of health should be a part of our vocabulary as leaders because it's showing up in our workforce. For example, you hire a phenomenal person as let's just call it a data analyst. Phenomenal person. They showed up in the interview. They were phenomenal. They came to work. They were somewhat tired. Have you considered where they're actually living and whether there's transportation? What did it take for them to get to work? But oftentimes we go to they're not productive, or we make some assumptions instead of having the discussion about their transportation. What about, do people have enough food? Are there food insecurities? And we have this thing of if a person's making $50, $60, $70,000 that they have, that how many dependents do they have? How much are they having to stretch that 60, 70, even $80,000? What about, do they have a community? Do they have a social community? The Gallup poll, one of the top indicators, which our leadership team talked about this as a retreat, one of the top indicators of employee satisfaction is whether a person has a best friend at work. Now, that blows my mind because I'm thinking my best friend is not necessarily at work, but we have people at work that hear us, see us, and are advocates for us. It matters, the social context and having community. That's another social determinant of health. So if as leaders, we look at it through those lenses, it absolutely impacts our P&Ls.
That's so well said and so pervasive. And I gotta wonder, how do we get that conversation going? Because, you know, there's been a lot of emphasis on DEI programs, and companies have embraced those, and they've you know, kind of taken those as a serious topic and have conducted training and other programs. How do we compare that type of program to what kind of innovation might be the right forum for health equity conversations?
So the conversation, again, I think if we recognize that these social determinants of health can affect up to, Robert Wood Johnson Foundation had a study that was conducted, and 80% of an individual's health outcomes has more to do with the social determinants of health than what we traditionally think of as a clinical diagnosis, et cetera. The number of people who are sitting right there in your plain sight, who are going through, stressing out, dealing with circumstances, and therefore really eating away at your bottom line, it's just good business sense. And so innovation is what we call a model office blueprint, a toolkit that helps managers. So, the average, I know, I'm an employer, you struggle with the labor laws against what we're dealing with in a workforce, especially post-COVID. And so what you're dealing with is how do you stay within the parameters of the laws and still get the most out of your most valuable assets? That's innovation. Innovation, understanding that your managers, depending on your organization, may need to have a certain technical expertise. Your directors, they're driving bottom line. But there has to be a way that we're able to understand and have the prompts, which I believe is innovative, the prompts, the conversation cards, so to speak, so that you understand as a manager how far you can go to help solve some of these problems that are pervasive in the workforce.
Well, it strikes me too, as I compare back to DEI programs, this seems like a much more broad-based, universal approach for everyone, any employee. It's not just very specific about a specific person who suffers from a situational social determinant impacted. So I'm wondering, how do you get that message across and this office model blueprint sounds like a really forward step to at least getting the awareness up and helping open the channels of communication and really try to quantify the value of these programs and the return, because that's what companies ultimately they're beholden to some stakeholder, some shareholder, and we need to be able to kind of give them a real world view of the benefits. And I'm wondering, what would we be looking at in terms of measures for a company? Is it truly like the reduced absenteeism, increased, I don't know, engagement, participation, and that's kind of soft skills. But you've had the opportunity to really see the gaps, and I think we're trying to close the gaps, and it's really the solution that makes a lot of sense right now, which is to bring together the forces of governmental regulation where people slip through and aren't getting the full kind of support that they need. And so it sounds like the employer has an opportunity to step in and build some safety nets, or some way that embraces and envelops their workforce, so that it can be one of the most competitive industries across the board, and especially in technology. So I'm just trying to frame it and understand, how do we get the message to even the government? They have the largest employee base. How do we define that? How do we have that conversation? I'm just trying to get my arms around it, and I'm sure other employers are as well. And
absolutely. And so I want to start with something you said early on in that question or thought, and you were saying this sounds more inclusive than the DE and I initiatives. I don't believe that there is a person alive who's not impacted in one way or another by health equity and the consequences of health equity, especially when we're looking at it through the lens of social determinants of health. I will share with you, I am walking through an experience with a gentleman who is educated, a gentleman who has access to a considerable amount of money, and who has a life-threatening diagnosis. And even then, there was a challenge with access, because the appointment that he was going to get was going to be 3 months after he was told about this diagnosis. It took leveraging relationships to move him closer to the front of the line. What I'm trying to say is, this is absolutely universal. Absolutely. And what is the key performance indicator for a company to say, wake up? Well, here's the truth. There is another study that said $42 billion a year is lost because of a lack of productivity. $42 billion. If that's not enough for us to recognize and connect that people can't be productive if they're dealing with barriers associated with the social determinants of health. And I just want to make sure everyone listening knows what the 7 are: food access, healthcare access and quality, neighborhoods and built environment, social and community context, economic stability, transportation, education. That affects all of us. Now, let's not sugarcoat it. those in marginalized communities and those who come from marginalized communities are disproportionately affected, but others don't necessarily escape it. And even if you personally aren't impacted, if you're in the workforce, you're impacted. Let's take the frontline worker who has a certain responsibility and is dependent on your team member being there and being available. And if that team member is experiencing this and out, guess who has to do the work? You. So this whole thing about work-life balance, it just went out of balance. No, you can't escape it because it affected your peer. Let's talk about the manager. So the manager has goals to receive. That person is dealing with it, they're out. The manager then doesn't reach their goals. Let's go to the director level, the VP level. Let's go to the CEO level. We can't escape it no matter where we are. So to say it does not affect everyone in the workplace, it absolutely does.
So your model blueprint is kind of the innovation that will open the doors and open the eyes for employers to realize that if we don't take time to inventory and check in on health equity as a construct, we're going to cease to be, if we are, the most competitive workforce in the world. And so I'm just trying to better understand, the comparing it. I only have a comparison to the DEI programs, and this would be, it sounds like much more interactive, much more broad-based. And what kind of form would it take? Is it, mental health support? Is it some sort of a coach or guide or individual training? Is that kind of what you're envisioning, or?
So I say step one is, and we've just gone through this process internally. And in our strategic planning and coming up with our 3 top line goals and coming up with the action steps, the strategic steps to reach those goals, we have been very intentional about accounting for the social determinants of health. Do they show up on a roadmap or a strategic plan? No, but it's understanding that some of the goals that we're setting, are we setting it understanding our workforce? No longer can we afford in corporate America to simply base our workforce on the educational pedigree. No longer can we just base it on their years of experience. If COVID didn't show us anything, your degree and your years of experience did not matter. Your ability to cope and have grit and to be able to persevere mattered. So if we want to get the best out of people, it starts with leadership creating a strategic plan, recognizing that when we say our people are our most valuable assets, there's a business case for that. It's not just a nice thing to say. And so being able, and I do think it's a paradigm shift. It's a paradigm shift for us. It's a paradigm shift for us to recognize that it's imperative for us to take into account what happens outside of 9 to 5. I remember as I was moving up the corporate ladder, I was really told and raised to leave your problems at the door.
Yeah.
I don't know if you're keeping up with this new generation. That's not what's happening. And so we can keep pushing, leave your problems at the door, or leadership can recognize it's hard out here to get a good workforce. And so you really need to work with what you have, because the price to go back and backfill and train and
that
It's
has
not worth it.
that has a cost.
Worth it. And so I'm saying the toolkit starts with the concepts to help leaders be able to do their strategic planning. That's number one. Then number two, the director level and manager level who has to work with the team to give them the language that really doesn't move more into triggering a bigger problem that they're then going to have to solve. But then finally, it is helping the frontline individual understand it and manage it for themselves so that they are empowered to use their words, use the language to communicate. Communication as a professional, this is a partnership. So it's your responsibility to communicate and it's your leader's responsibility to communicate. But if we're not using the same language, and I think that's what this does, it gives us a common set of language to have more effective and relevant to today's world communication.
Wow, that's a really interesting way to look at it, and kind of trickle down. It even strikes me that, you know, it trickles down, but it's a kind of a prevent defense where you're teaching kids and everyone and anyone in a workforce how to be supported in a way that by the time they get to needing Medicare or Medicaid or any sort of healthcare plan, they've maybe course corrected or learned to cope or figured out new ways to build their network. So if and when they are afflicted with a disease, they know that person to call that can, you know, open doors and bring them into a doctor sooner than they might otherwise. And I think those are the hard pieces of I think quantifying, you know, the network, the building the network and the support mechanisms and the teams. I think it's kind of I don't think you can measure that in a way, but there are things you can measure. And I think if we learn how to close the gap now between the vulnerabilities that exist in their state today and help them, you know, either as an employer or as an employee, understand the benefits of that. And, you know, conquering your demons is, you know, part of the process. And I think employers have a really great opportunity to apply principles and practices that could really manifest in a more productive, more rich culture and be one of the desired places to work. I mean, ultimately, a Glassdoor rating, because you've put in these programs, would be, I think, returning volumes. But again, some of those are just not able to be quantified, but I think the soft and the harder, more visible skills can be communicated to leaders, to companies. How do you envision kind of a future state of wellness, or like what does that look like, and where do we begin? Who do we talk to? How do we open those doors? And I think I'm trying to understand a little more about how do we activate this, right? I mean, it's clear there's a problem. It's clear there are new ways to understand the problem and apply various actions to get ahead of this. And so, or maybe it's gotten ahead of them already and they need to catch up. So I'm trying to just envision how that works.
I think so. Let me just say that based on I think in our world today, we think of innovation from a system. Um, AI is taking over, and that's like the sexy, innovation. Uh, the legislation, the executive order that just came out on October 30th with the new standards for AI, I think that even proves to us that uh, IT systems, all of that alone, if we just let it go, it could run amok, and it causes issues from fraud to all kinds of things, as that executive order um, is stating. And so one thing that will never go away, I don't believe, and that's the need for us to be able to communicate. That's the need for us to have bridges between generations. That's the need for us to have empathy for a person's situation. So I am simply saying, what's not going away? We need to have a bottom line for a company. What's not going away, at least in our lifetime, in my lifetime, I don't believe, is that I'm going to be able to replace everything that I do with a robot. I just don't believe that. So if that is the case, there's not when I go to these CEO events, et cetera, there's not a person that I run into who's not talking about the challenges with finding workforce and retaining workforce. So how do we everybody's talking about it, but I don't believe people are talking about the root cause.
Yes.
And so I am simply saying, until we recognize that the person is a whole person, that we can have health insurance all we want, but health insurance speaks to a portion of it. And where people spend the majority of their time, if they cannot present as their full, unique, authentic self, we are not going to have ultimate performance. And so there lies the innovation, is how about we stop for a moment and consider what are the true needs of today's workforce.
Yeah, that's really interesting. And as I think about today's workforce that works from home more than they do in the office, does that add a layer of complexity or to try to?
Oh yeah, because that's the other thing. So that's why and I think with COVID, with the pandemic, I mean, the COVID, hasn't gone away. The pandemic, we're out of the defined pandemic, but that I think is what really we could see a light that was shining on the fact that whatever's happening at home, it became something that you had to factor into a person's work.
Yeah.
And they are working at home. And I don't care how many policies you've written. You don't have the police in their space to say exactly what they're doing. So the sooner we recognize that people are literally they're literally juggling their personal life and their professional life. And so our standards, our policies, our are we keeping up to speed with where people's lives are right now? And if there's a shortage of workforce, it would appear to me that it's a supply and demand. So if there's a shortage of supply, it will demand that we mine that supply in a way that we create diamonds and not just throw people out because they didn't walk a certain way or talk a certain way, or because there's a history there. There's there's an environment that they're coming from. There's a
Yeah.
culture that they're coming from. And so again, I believe 100% and see it in the data that it is a business decision and a business case for health equity in the workplace.
That's powerful. I mean, I think you have a unique vantage point in that you've got a deep understanding of the regulatory environment in terms of healthcare policy. And as an owner operator in your journey, you've watched the transformation of your business and given it life and a persona of understanding how it needs to be nurtured and cared for, and when it recoils because the employees aren't getting what they need. You've been very methodical about observing and analyzing how to change that, to change course. And I commend you for that, because not many employers are ready to embrace change as a general rule. And I think we have a couple questions in the chat. I'm gonna try to jump in here and have them have you share them with you. We have a gentleman who's an interim CEO, and he says, I heard you mention that health equity can reduce absenteeism and employee turnover. This can be of tremendous value right now. Do you quantify that opportunity for a client? And if you can, where do I sign up for gap assessment? Well, he sees the value clearly.
Well, where do you sign up? Go to ARDX.net and you can sign up. But absolutely, and there are, as far as reducing absenteeism, I think, again, it depends on industry, it depends on a whole, a lot of variables, but being able to get some of your data right now, as far as what is your percent of absenteeism.
Yeah.
And then I'm just curious, how have there been discussions with the individuals who have the highest amount of absenteeism through the lens of asking these particular questions associated with the 7 social determinants of health? I can just tell you from our experience, these are triggers that lead to bigger issues that all we really we could have helped solve for some of those, like us potentially changing a shift that they're working, for example. So maybe there could be a switch with someone else, for example. So those are just some of the things. And again, they're unique circumstances.
And
That
sometimes coming in from an objective vantage point, you see things that, the people that have been working there are just too blind to see, because they're too close to the problem and they can't separate. But I think that's spot on. Another question says, many businesses participate in surveys and awards for best places to work to attract top talent. Is health equity part of the criteria for these programs, or should it be?
Of course, my answer is going to be yes, it should be. Is it? It's not. And I wonder with some of those programs, again, I'm sure that they have not looked at the workforce in this way. This is a unique way of looking at the workforce.
Sure.
And the productivity of the workforce. And so perhaps that should be evaluated. And data collected and the study run to be able to see how does that add to creating a best place to work.
Excellent. Well, Angela, we have had an amazing exploration into the the way to shore up the gap in health equity and especially in the workplace. And I thank you because your journey has gone from experiencing health equity firsthand and transforming it into wealth equity. And so you are the perfect picture of success and transformation, and you see it, you feel it, you believe it, and I encourage others who want to learn more about what can be done to institute and implement a sense of accomplishment, achievement, and well-being, really, on many levels. So,
well, thank you for this time. It's been
thank you.
really enjoyable sharing. So thank you all.
Yeah.
Yes, so thank you both for this insightful conversation. Thank you to our audience for joining us today. Thank you again, Angela, and also thank you again, Dima, for this wonderful event and conversation. And I hope everyone has a great rest of their day.
Thank you so much, Olivia. Have a great day, everyone. Take care.
Bye-bye.